I just remember that because I've never I've never been asked to feel someone's breast before in a trade show. Welcome to the Chinese Medicine Podcast, the place where you can come to get Chinese medicine easily explained, get your questions answered, and learn about yourself and your health in a Chinese medicine way. My job on this podcast is to help people understand Chinese medicine, and I want you to understand it for yourself so that you can use the great things that Chinese medicine has in an everyday way to help you at home. And also to understand the treatment that you might be getting with your practitioner, to understand things in a deeper way in those terms. As with every podcast episode, and I do this from time to time instead of just doing it every single time, you just need to make sure that if you do have a health problem, please go and see your practitioner. Don't use Dr. YouTube to fix you. That's just insane. This is not a replacement for health advice that you may get from just seeing your practitioner, whether it be a Chinese medicine practitioner, whether it be your your herbalist, your acupuncturist, whoever you see, or your GP, your general practitioner. You know, if you've got something wrong with you, or you've got something that is bothering you, or health problems that you haven't been seen with a doctor, even a Chinese medicine practitioner is going to refer you to go back to see your GP or your doctor when they find symptoms that they don't know what they are in a Western medicine sense, who had no diagnosis for that. So it's a good idea to do that. And please don't use YouTube as a replacement for medicine. That's very important. I just want to make sure that that's very clear for people to understand. Now, there's lots of things you can do for yourself. And what we're going to talk about today, we're going to talk about something that is... I've been wanting to make this video for a while, and it's something that is very important to me in terms of where I think Chinese medicine's going. And so I've been doing Chinese medicine for how many years now? Okay, so I graduated in the year 2000. It's 2019 now. So I've been practicing for 19 years, right? Nearly 20 years. And I've been around Chinese medicine for more than that because I was studying it as a youngster. Now, there's another video I've got. Someone recently asked me that question as well. Like, how'd you get into it, Marie? What led you to Chinese medicine? So there's a video on here somewhere. It's in one of the channel updates, and in the description you can see it says, I'll find out about how I got into Chinese medicine. So if you're interested in that, you can just click on that video. And so I've seen a lot of changes happen to Chinese medicine through the time, and I think something that's important to understand is how natural health and natural therapies fit into the landscape of medicine in the country where you practice. Now, I know a lot of viewers on my channel are from the USA, and that they're going to have different laws, and they do have different things in every different state there. But this is for Australian viewers. But if you are from the USA or you're from another country, take note of what I'm saying, because this is possibly could happen in your country as well. And so I just want to give a little overview of what's happened in Chinese medicine over the years. What's happened? So when I first graduated Chinese medicine, it probably wasn't as well known as it is now, for sure. Like less people I treated had acupuncture. And so there is a growing amount of people who've had acupuncture, and certainly who've had needling. And when I graduated, there was dry needling was very, it wasn't done that often. Now, one of the reasons why it wasn't done that often was in WA, where I'm from. So going back to that time, 2000, the regulation of health practitioners was all done state by state. It wasn't a national thing, right? So the Physiotherapy Act of, I think it was 1950, that act was still in place, and that prohibited physiotherapists from needling the skin. The act actually said they couldn't penetrate the skin. So some physiotherapists were doing it, but they were breaching their own act by doing it. But there wasn't very many physiotherapists who were doing it, but there were some. And I know that because I worked at a physiotherapy clinic when I first graduated. There wasn't any jobs in Chinese medicine, and I kind of wanted to treat patients. And I had a really special interest in Tuina, which is like Chinese massage. So I used to go to this clinic I was basically employed there as a massage therapist. And I did Tuina, and so I was my way of learning Tuina and just getting familiar with treating patients. And at the same time, I was kind of starting my business. And when you start, you don't have any clients, and so I was just kind of I rented a place where I could work a few days a week. I worked at my teacher's clinic once a week, which was quite far from where I was living. So I was kind of doing 3 jobs at once, basically. And the physio clinic where I worked at, one of the physios there bought a box of needles and just started sticking it into patients. And I was kind of appalled, but I was also like 21 or 22, probably 22, I think. And I didn't know much like about how to approach those sort of things. I mean, I'm pretty strong-willed and pretty, I know what I want. I know sort of how to go about getting it. But at the same time, I didn't know what to do. And I was thought, oh my goodness, how could someone do this? It's so unethical. That's what was going through my mind. Even at that age, I was like, this is not right. And so I just resigned, and I wrote a letter saying that was the reason why I resigned. And I said, look, I can't reconcile, I couldn't even work in a place where someone was willing to do that. And because basically they hadn't done a course, or they'd done a very short course, but pretty much what they had done, I mean, the physio had kind of admitted that he was just bought a box of needles and started sticking it into the patients to sort of learn how to do it, because say that someone there had asked me something about acupuncture. Like I think the receptionist had said to me, oh, so-and-so physio wants to know about something about acupuncture, this blah blah blah. And I'm like, bloody hell, I'm not like that to me that was just, why, yeah, anyway. And it just was completely, I think that time physios, because we didn't have any registration at all, and so it was just like, oh, we're not legitimized. It's just like people thought you were woo-woo, mystical, some kind of weird profession, right? And that's what it was. Like that's what a lot of people thought in my circle of influence. That was a very common perception. People just didn't think of it as a proper medicine, and that's also got to do with China, how we in Chinese medicine have kind of propagated it as well. I mean, it's not how do we say that? It's not all other people's fault. Like the perception that people have of something is like, especially the way I think I mean, not everyone thinks like this, but I take ultimate responsibility for everything. Like you have to be responsible. And so, that is one of the reasons why I'm making this podcast and making these videos, because I think, well, I've got a responsibility to do whatever I can do. And this is what I think, this is the best I think I can do right now. And so this is what I'm doing to share that knowledge and to get the right idea out there. So I was practicing in this physiotherapy clinic. I quit working there. I just wrote this letter of resignation. And I was like, I remember being so angry that we didn't have registration, thinking that registration would fix everything. Registration would fix this whole thing of like, we're not legitimized where our profession is, and the other thing that was really stuck with me was, so when I studied Chinese medicine, there was no glory in it, I guess. I mean, maybe it depends on who you hang out with, but I like, people just didn't know what it was. I was constantly having to explain myself. And even now, like sometimes I get in an Uber and an Uber driver goes, oh, do you have to study to do that? And it's like that. I mean, I can understand those questions, not out of legitimacy, but out of just curiosity and like just ignorance, complete ignorance. But it's like, dude, are you serious? Like, do you think that like you've got this professional, or sometimes people say, oh, does it work? And it's like, I said, oh, well, I've been running my business for like 12 years, but I'm not really sure. Like, of course it works. Like if patients, to some extent it has to, if you're running a business that's been going for that long, like there's no way you would stay in business if patients didn't come back. They're all paying out of their own pocket. Like that's just, that in itself is telling you that there must be something to it. Like if people can build businesses out of it, and that's all based on private practice anyway. Because it must have some benefit to people in some way, right? But all that aside, so that happened. And then when I went to China, like a really interesting thing happened. And I often encourage students to go to China just for this reason in a way, because I mean, there's lots of reasons why you should go to China and do some study there. But I really felt like people respected Chinese medicine. And in the West, I've often found people don't respect it. Now, I'm around lots more people that do now than I was when I was 21. And that's just because how my circle of influence has changed. And also I have some great teachers and I have some great people around me that I respect in it more and more and more. And that builds this culture of people like, so I'm surrounded by this bubble of people that respect and revere and honor and love Chinese medicine. But you go out into the normal world and it's a different story. So I remember being in China and like telling people what I was there for, and then, I mean, they respected me so much because I was a foreigner learning it for one. And they thought, oh wow, you're learning Chinese medicine, and especially since you could speak a little bit of Chinese. I was like, whoa, write some Chinese. They were like, whoa, that was amazing. I mean, my Chinese is terrible. It's just like, very rudimentary, especially then. I could hardly do anything, but I was just trying, I was giving it a go, and I was like trying to learn as best I could. I could write a lot of herbs in Chinese at that point because my teacher kind of made us do that, and that was good. And so the doctors in the hospital would see you kind of doing that, and they'd be like, "Oh wow, that's great! You really want to learn." And but just people in general. And one time, a few years later, I went back to China for business, and I was there at the Canton Fair, which is like this massive, giant, super duper fair with just it's hard to explain. I'll try to get some footage and put it on over the top of this video so you can kind of see the idea. But so Canton Fair is like a mega giant fair. Like basically anything in the world you ever want to buy, you could probably find a factory that's going to make it there. They do it over 3 weeks, and they have different things on each time. And I was there with my friend buying some furniture. So he had an antique furniture business, and I was there just helping him, and he was kind of helping me in my business. And so at this point, he was basically just buying his container of furniture from this place. And they basically have all these kind of things set up to like pick and choose from, and catalogs and things like that. And I was exhausted at that point. I've just been looking at stuff all day long, and it's a lot of walking and everything. So I just took the moment to sit down, and I was like, right, I'm just sitting down at this big display bench and kind of just contemplating life and it's all its mysteries, just sitting there. And my friend used to get a real big kick out of seeing people find out my profession, because they would be like, wow, and it was very, very obvious on their face. And I had some little business cards made up, and I'd taken a leaf out of my teacher's book actually, and I put Chinese characters on there as well, so that they could kind of read like, okay, do acupuncture, do Chinese herbs and things like that. And so that goes a long way. I mean, business cards in China go a long way. It's like, whoa, like they love that. They love that business card. And so, got a business card that's like legitimizes anything. Anyway, so I'm at this Canton Fair, and I'm sitting there just trying to like gather my thoughts and just have a moment. And my friend's buying his stuff, and he mentions to the people that are there's a couple of other girls that work in the factory that were kind of sitting down at the bench, and he says, "Oh, Marie, show them your business card, show them what you do. Like, Marie does Chinese medicine." And they're like, oh, Chinese medicine. And I was like, yeah. And that, so they sort of look at it, yeah. And so I pulled out my card and I showed them, and they're like, oh, Chinese medicine. And this girl that works there, she goes, "Oh, I just had a baby," and she grabbed my hands and put them on her breast, and she's like, feel my boobs, feel my breasts, they're so hard, and the milk won't come out. And I'm in the middle of this fair, and just like making me touch her breast. No no privacy, no, she doesn't care. And I was just like, oh, okay, I can feel that your breasts are very like distended and firm. And she's like, "Oh, what herbs should I take? Can you write me out some herbs? Like, check my pulse and give me some herbs." And like just that, I just remember that because I've never been asked to feel someone's breast before in a trade show, but that was another example of like people just trust Chinese medicine. Right now, I could be out with a circle of friends, and they'll be like, "Oh, my breasts are distended and sore, and the milk won't come out," and I'll say, "Oh, Chinese herbs can kind of help that." Now they don't get all excited and go, "Oh, wow, would you help me? Would you write out some herbs for me? Oh, that'd be great." You just get this thing of when people just, "Oh yeah, okay, whatever," like that. I mean, that's not everyone's like that, but in general, there's just a big trust of Chinese medicine in China. Like, and it's because, and you don't have to kind of like, there's just an inherent like respect for it, I guess, and trust for it. And one is probably because people have used it over and over in their lifetime, or they've seen it being used, and it's familiar around them. Whereas when you use something for the first time that's new, as a patient yourself, like let's say a lot of people watching this channel have probably used Chinese medicine before, and so it's going to have some aspect of familiarity to you, and so when you get sick, you think, "Oh, I'll use Chinese medicine for that," because it's helped you before. It's the same as if you've had a good experience with something else, like you just instantly want to go back to that thing. I mean, I've seen tons of patients over the years where I might not have seen them for 5 years, and they come back and they say, "Oh, you fixed my shoulder pain. Can you do it again? Like, I've got the shoulder pain again," and I haven't seen them for 5 years, and they didn't even tell me that they were helped the first time, and I'm just there thinking, "Oh, okay, you didn't come back, so it must not have gotten better." That's probably what I've assumed, like, because they only had 1 or 2 treatments. And But in their mind, you are the person that fixes, shoulder pain because you've done it once. You can kind of do it again. So I can understand that, and that's just how our human mind works. Like we associate those positives and those negatives together. And when something's not familiar to you, there's certain personality traits where people are more open to, like they have a greater openness to new experiences, and some people are just not wired that way, and so to experience something new would have to take a lot for them, and it's not something like they're just, oh, I'm curious, let me try acupuncture, oh, I'm curious, let me try moxibustion cupping or Chinese herbal medicine or something like that. So what's happened in Australia is, going back to the original story, was I was like super excited about doing Chinese medicine when I was studying it, and then I graduated and I was kind of like, okay, I'm gonna have to fend for myself here, and I never thought otherwise. It wasn't like I was expecting to go into a great job or anything ready for me. And so being self-employed is kind of like, you have to really fight for everything. You have to build everything yourself. You have to get all the patients yourself, you have to pay all the bills yourself, you have to do all those things, and and work, and so you soon learn what works and what kind of doesn't work for those situations. And so that's where I was at, and I was very keen for Chinese medicine to be registered, because I thought that registration would bring some kind of respect to our profession, and some kind of almost like an endorsement as a profession, like a legitimization almost, in a way. Not that it needs that. In my mind, like, it didn't need that, but I thought in the public's mind it might bring something like that. Now, I know that registration is not about that it's not about it's about protecting the public. Like, that's why they have registration boards, is because certain therapies are kind of deemed to be dangerous if they're practiced in unskilled hands. Like, any old man and his dog could kind of do it. And like, that's also one of my concerns, is that we don't have the public placed at risk. But I think a lot of practitioners were hoping for that legitimization, hoping for that respect, and also being that ability to be able to help more people by being able to work alongside other professionals in our profession as well. I think that's part of it, and it's, for most Chinese medicine practitioners, the concept of that isn't very foreign, because the majority of practitioners who studied in Australia, they have been to China and they've seen that dual medicine system in full swing. I mean, they have hospitals there just for one disease. Like, they have a whole hospital just for hepatitis, let's say, or just for prostate diseases, or just for men's diseases, or just for like liver diseases, or all kinds of different things like that. And so, like, you see this really specialized, honed approach of Chinese medicine working alongside Western medicine. Like, in my training in Tui Na, for instance, which was Chinese massage, I did like so many different things that, like, just the ability of what it could do was like, wow, it can, they were using Tui Na before and after surgery to help people recover quicker. They were doing acupuncture there. They had the use of acupuncture for strokes and things like that. They basically had it set up as part of the protocol before and after like Western medicine treatments and things like that. And, gave patients a choice in what they wanted to do in some instances. Like, the herbal doctor I was studying with would often treat patients with Western medicine, because that's how they study there. A herbalist can practice, like, basically similar to a GP that can prescribe those kind of drugs and monitor patients with drugs and things like that, and then also give them Chinese herbal medicine. So they could give them both of those things, or modify dosages of both of those things. And it's very interesting to see those things work alongside each other. And I mean, there's good and bad to both of those things. I certainly don't really want, like, it's not like I'm busting a gut to practice Western medicine or anything. I enjoyed just purely practicing Chinese medicine. But what I enjoyed seeing was the benefit that it could bring to patients who have, like, very severe illnesses, who would only be able to be seen because they were in a hospital. Basically, they were so sick that they wouldn't come to a clinic. And it's certainly in Australia, they just wouldn't make it to your clinic probably, unless you do see some patients from time to time do that, but not a mass amount of people kind of in those ways. So I guess what we were hoping out of registration was the ability to kind of work more alongside, Western medicine, or just within the public health system, right? So being able to, like for instance, there's a thing on the table at the moment within the government, the chronic pain management scheme, and like, okay, acupuncture is perfect for that. So, like, there's plenty of research that shows the effectiveness of acupuncture for treating pain. That's one thing that, like, no one can deny that acupuncture is effective for treating, pain, especially acute types of pain. And there's, different research on different types of pain and things like that. But in general, but you can't really argue that it doesn't help pain. Now, whether it stops the problem or does that is irrelevant. It just, like, let's say you just want to reduce pain, it can reduce pain. And the benefit of that, aside from a drug, is that you're not putting another substance into the body. So let's say the patient's got, you don't know what's causing the pain, and you can't overdose them with acupuncture. Let's say, or you can't interact other medications with acupuncture. So that's like a huge benefit to Western medicine. If you've got patients, like let's say you've got an emergency room full of patients. It's used in the USA in like what they call battlefield acupuncture stuff. So the military use it for different kinds of things like that. So I've told you a little bit about my journey in terms of how I got into Chinese medicine and what like the respect thing and the admiration and the legitimization things that were hoped, I guess, to get out of registration, and also the ability to practice alongside of Western medicine or practice within the public health system in some way, in some capacity. And I think within that, the other aspect is like patients' out-of-pocket expense for healthcare. Like if Chinese medicine could be part of Medicare, then that was a hope that I guess would help practitioners to like be able to treat people that couldn't otherwise afford treatments. They couldn't just pay for them out of pocket.